Two people came to the clinic one day. Kara is a 66-year-old woman who came to the clinic after noticing gradually developing left arm swelling and redness over the past 3 months. Physical examination reveals a tender, purplish lesion along the left armpit. She has a history of hypertension, diabetes, and breast cancer that was treated 10 years ago with a modified radical mastectomy and radiation therapy. Clay is a healthy 1-year-old infant brought by his parents due to a rapidly growing red bump on his face. He has no history of trauma, and the lesion didn't appear anywhere else. Physical examination reveals a raised, bright red nodule on the left side of his face and no other abnormal findings. Now, both Kara and Clay have vascular tumors. There are many types, so it's best to classify them into benign and malignant tumors. Let's start with the most common benign vascular tumor in children, the strawberry hemangioma, where hemangioma means a benign tumor of the blood vessels. A strawberry hemangioma appears as a superficial, bright red skin lesion that looks kind of like a strawberry, and they commonly affect the face. Histologically, these lesions are confined to the epidermis. Now, a typical strawberry hemangioma develops in infancy and grows pretty fast, but fortunately, it goes away on its own by 5 to 10 years of age. So in terms of management, exams like to bring up a very concerned parent, but the correct answer will almost always be to reassure the parent that the lesion will regress without treatment. Now, a related disorder is cherry hemangioma, which is the most common benign vascular tumor in adults. This tumor appears dark red like a cherry. Histologically, this lesion extends to the superficial papillary dermis, so they reach much deeper than strawberry hemangiomas. These tumors increase in frequency with age, and unlike strawberry hemangiomas, they do not regress spontaneously. Cavernous hemangiomas are soft, bluish lesions, and unlike strawberry and cherry hemangiomas, they're usually seated in the deep dermis. The word cavernous means cavern-like, so it's not surprising that histologically these appear as large, endothelium-lined spaces filled with red blood cells. Cavernous hemangiomas can also be located in organs like the liver, spleen, and even the brain. Also, von Hippel-Lindau syndrome is an autosomal dominant condition that causes numerous tumors and cysts throughout the body, one of these being cavernous hemangiomas of the cerebellum and the retina. Look for a history of bilateral pheochromocytoma or renal cell carcinoma. The next tumor is cystic hygroma, or a cavernous lymphangioma. It's a benign tumor of the lymphatic vessels that typically arises in the neck, and it's associated with both Down and Turner syndrome. Histologically, this tumor is made up of endothelial lining, but the difference between it and hemangiomas is the absence of red blood cells, because lymphatic vessels have lymphatic fluid in them, not blood. Next up, we have pyogenic granuloma, which is the biggest misnomer in medicine. First, it doesn't produce pus, and histologically, it's not a granuloma. Instead, this is a benign, polyploid, or dome-shaped hemangioma that can ulcerate and bleed. Histologically, the tumor shows lobules made of proliferating capillary and edema, which makes it look like granulation tissue. Board exams will often give you risk factors, such as history of trauma to the area or pregnancy, especially in the first trimester. Next are glomus tumors. These arise in the glomus bodies, which are small arteriovenous shunts located in the dermis. They help regulate body temperature by shunting blood away from the skin in cold temperatures, and to the skin when it's hot. A glomus tumor usually arises from the smooth muscle cells in the glomus bodies, and they're painful, bluish-reddish tumors most commonly found under the fingernails. An important differential diagnosis is subungual melanoma, which appears similarly, but the difference is the presence of melanin-pigmented cells on histology, so it's important to get a biopsy. The next two tumors are associated with HIV. There's bacillary angiomatosis, which is benign, and Kaposi sarcoma, which is malignant. Bacillary angiomatosis is not technically a tumor. It's an infection caused by the gram-negative bacillus Bartonella henselae. It's thought that the bacteria enters the intravascular compartment and releases angiogenic factors that stimulate benign endothelial cell proliferation. Kaposi sarcoma, on the other hand, is a malignancy of the endothelial and smooth muscle cells caused by human herpes virus 8, or HHV8, or by HIV. It's still unknown exactly how these viruses cause malignancy. Now, both conditions appear as red-violet papules on the skin. Kaposi sarcoma also tend to affect the buccal mucosa as well as the gastrointestinal and respiratory tracts. So, beware for questions that pose Kaposi sarcoma as a case of GI bleeding or hemoptysis. The best way to differentiate the two is microscopically. Bacillary angiomatosis shows gram-negative bacilli using Wharton's starry stain, as well as neutrophilic infiltrate. On the other hand, Kaposi sarcoma shows spindle-shaped tumor cells along with a lymphocytic infiltrate. Okay, another malignant tumor of the blood vessels is angiosarcoma, which is a cancer of the endothelial lining of the blood vessels. These are more common in older people and affect sun-exposed areas like the head and neck. If the person has a history of radiation therapy, like for breast cancer, they can also develop. A specific type is hepatic angiosarcoma, which is linked to chronic exposure to arsenic and pesticides, polyvinyl chloride, or PVC, which is a plastic commonly used in industry, and thorotrast, an old contrast medium. A helpful clue is that hepatic angiosarcoma cells express CD31, also called PCAM1, which is normally expressed on the surface of endothelial cells and acts as a binding point for leukocytes. However, in angiosarcoma, CD31 promotes angiogenesis, which is how these tumors develop. This is a way your exams can connect this pathology with normal physiology. Lymphangiosarcoma is similar to angiosarcoma, except it involves the lymphatic vessels. The main risk factor is chronic lymphedema, which can arise after a mastectomy or lymph node dissection for breast cancer. Alright, now that we've looked at the vascular tumors, let's shift gears and go over the cardiac tumors. The most common primary cardiac tumors in adults are myxomas. Myxoma is derived from myxoid, which means connective tissue. So, myxomas are benign tumors derived from undifferentiated connective tissue cells in the heart. A high-yield fact is that most of them occur in the atria, especially in the left atrium. The tumor obstructs blood flow through the mitral valve, causing a decrease in the left ventricular stroke volume. Remember for your tests that a common presentation is multiple episodes of syncope. Other symptoms include shortness of breath on exertion and palpitations. Atrial myxomas produce vascular endothelial growth factor, or VEGF, which promotes angiogenesis, making the tumor friable and more likely to bleed. Myxomas also make interleukin-6, a cytokine that leads to systemic symptoms like fever and weight loss. Exams can use this information to tie in concepts relating to immunology, like the fact that interleukin-6 is also responsible for the production of acute phase reactants, like CRP and fibrinogen. So, they could use a scenario of an atrial myxoma and ask, the cytokine produced by the pathology this individual has is also responsible for auscultation of the heart apex shows the classic tumor plop sound during diastole. Transesophageal echocardiography, or TEE, confirms the diagnosis, revealing a pedunculated mobile mass in the atrium. The reason we go through the esophagus is because it's directly posterior to the left atrium, providing us with a good view of the left atrial chamber. Microscopically, scattered connective tissue cells are seen mixed with a gelatinous mucopolysaccharide stroma. Okay, now the most common primary cardiac tumor in children is cardiac rhabdomyoma. Rhabdomyomas are hamartomatous growths of the cardiac muscle. Hamartomatous means benign hyperplastic growth, meaning there's no neoplasia. The vast majority of cardiac rhabdomyomas are associated with tuberous sclerosis, a genetic disorder that causes tumor formation in various other organs like the brain, eyes, lungs, liver, and kidneys. A big clue is adenoma sebaceous, which are flat, reddish lesions on the skin that resemble freckles. Alright, as a quick recap, vascular tumors are benign or malignant. Benign tumors include strawberry hemangiomas, which appear in infants and go away spontaneously, and cherry angiomas, which appear in older people and do not regress spontaneously. Cavernous hemangiomas are more deep-seated in the dermis and can also involve internal organs like the brain. Cystic hygromas are lymphangiomas located in the neck and are classically associated with Down and Turner syndrome. Pyogenic granulomas are pedunculated and are associated with trauma and pregnancy. Glomus tumors are benign tumors of the thermoregulatory glomus bodies and are located underneath the fingernails. Bacillary angiomatosis is caused by Bartonella henselae, while Kaposi sarcoma is caused by HHV8, and both are associated with HIV. Hepatic angiosarcoma is associated with exposure to arsenic, PVC, or thorotrast. Lymphangiosarcoma is associated with chronic lymphedema, such as after a radical mastectomy. Cardiac tumors include atrial which is the most common in adults, and rhabdomyoma, which is the most common in children. Alright, back to our cases. Considering the appearance and location of Kara's lesions, it's likely that she has lymphangiosarcoma, which is caused by her previous modified radical mastectomy. Next, because of his young age and the appearance of the tumor, Clay likely has a strawberry hemangioma, and his parents were reassured that the lesion usually goes away on its own.